Hello everybody! Today we are going to look at Acanthamoeba species. Acanthamoeba species are free-living amoebas, can cause infection in humans and animals, cause diseases such as amoebic keratitis and encephalitis. Encephalitis is caused when Acanthamoeba enters cats and spread to the central nervous system. Distribution: Acanthamoeba keratitis (AK) is a rare parasitic eye infection from a certain type of amoeba. It affects the cornea, the clear dome-shaped front covering of your eye. When not treated, it can damage your eyes and cause loss of sight. Acanthamoeba species are found worldwide in various environments including soil, fresh water, seawater, and air. Habitat: Acanthamoeba species can be found in soil, where they survive and reproduce. Fresh water: they inhabit freshwater environments, including lakes, rivers, and ponds. Seawater: Acanthamoeba can also be found in seawater, although they are less common compared to freshwater habitats. Air: while less common, Acanthamoeba species have been isolated from air samples, particularly in dusty environments. Man-made water sources: they are commonly present in man-made water sources such as swimming pools, hot tubs, and water storage tanks. Natural aquatic habitats: Acanthamoeba are frequently found in natural aquatic habitats where they play a role in the ecosystem as microbial consumers. Soil and dust: additionally, Acanthamoeba can be isolated from soil and dust samples, particularly in environments where organic matter is present. Morphology: Acanthamoeba can exist in two forms, which is the thrombozoites and cysts. In the next slide, I will be explaining the thrombozoites and cysts. Flagellate: some species have a flagellate stage. Size: typically 15 to 40 micrometers in diameter. Nucleus: large and centrally located with a prominent nucleolus. Cytoplasm: granular with various organelles. Pseudopodia: temporary protrusions used for movement and feeding. Acanthamoeba trophozoites: the trophozoite varies in size from 25 to 40 in diameter and has a long oval or irregular shape. The cytoplasmic boundary of trophozoite is unclear and the endoplasm is granular, which emits several acicular or spinous pseudopods extending to the whole surface of the cell. The pseudopods give the trophozoite a characteristic appearance and participate in the feeding and the movement of Acanthamoeba. Acanthamoeba cyst: unlike trophozoites, the cyst has a double-layer cell wall, which gives cysts strong resistance to many harsh environmental conditions. The outer layer consists of a laminar fibrous layer, also known as ectocyst, while the inner layer is made up of fine fibers, also known as endocyst. Life cycle: the trophozoites replicate through mitosis under less favorable circumstances. The trophozoites become cysts for survival. The trophozoites then enter the body via ulcerated or broken skin or through the lower respiratory tract. The trophozoites then invade the central nervous system via hematogenous dissemination. Pathogens: involves entry into the host, adherence, tissue invasions, and damage. This triggers inflammation and can lead to diseases like keratitis or encephalitis. In some cases, chronic infections may persist despite treatment. Clinical features: Acanthamoeba keratitis. Symptoms include severe eye pain, redness, photophobia, sensitivity to light, blurred vision, and the sensation of a foreign body in the eye. Vision loss can occur if not treated properly. Trigonomalutous amoebic encephalitis (JA). Symptoms can include headache, fever, stiff neck, confusion, nausea, vomiting, and neurological deficits. JAE is a real, bad, severe infection that can be fatal if not treated early. Immunity. The immune response to Acanthamoeba infections involves innate cells like neutrophils and macrophages, controlling the initial spread of the parasite. Adaptive immunity generates specific responses including antibodies and T cells to neutralize the parasite. Despite this, Acanthamoeba can evade immune detection and establish chronic infection in some cases. Diagnosis. Testing for AK may involve taking samples of corneal tissue. That can involve corneal scraping. To run this test, an eye specialist will take a sample of your cornea's outermost layer for testing. Corneal biopsies. This involves taking a larger tissue sample than with a scraping. The main advantage is that it can detect deeper infection than a scraping test. Both of these are more invasive and can be painful, but your provider will use numbing drops or medication to help with that. Treatment. Treating AK has two main goals: getting rid of the infection and reducing pain and other disruptive symptoms. Medication are usually the first option, and surgery may be necessary in more severe cases. Prevention. Acanthamoeba is mostly preventable, though uncommon cases can happen for reasons you can control. First, wear contact lenses as instructed. Don't wear your contacts for too long. Second, never use anything but contact lens solution to store your contact when you take them out. Third, clean your contacts in the case you store them in. Fourth, reusing contaminated contacts or contact lens cases can cause reinfection. Fifth, if your eyes feel dry, use artificial teardrops that are intended for use in the eye. Sixth, take precaution if you're at high risk for AK infection. Seventh, Acanthamoeba kytosis infection are always a threat with eye injuries. Protecting your eyes keeps them safe from damage, which also keeps microbes out.